Hi, my name is Talia, and today I'm going to be teaching you guys about long-term side lying and sitting. There are 3 goals when considering long-term positioning. These include safety, prevention, and patient comfort. So when considering safety, we want to make sure that we are preventing any fall risk, as well as maintaining an open airway. Prevention, we want to make sure that we position frequently enough that we can prevent those pressure ulcers, as well as swelling or edema, and contractures from sitting in chairs for too long. Patient comfort is the last one, so that is maintaining that normal spinal alignment as well as providing cushioning under or between the joints and other areas of the body. So now I'm going to be teaching you guys how to case a pillow, so we want to make sure that it doesn't come in contact with us. The easiest way is just to reach your arm into the pillowcase, grab the pillow, and then case it inside out. And now we have a perfectly cased pillow. Alright, so now we're going to be talking about long-term positioning in side lying. There's a few different things that we want to consider. So first, immediate safety. Second is normal spinal alignment. Third, prevent pressure injuries. And lastly, preventing edema and contractures. Alright, so we're going to be placing a couple different pillows in a few different places to avoid pressure injuries. So the first one, she's going to have her shoulder protracted out. So we want to make sure to tuck this pillow under the back. Help support the scapula there. Then we're also going to place a pillow between the knees. Go ahead and lift up for me, right in there. And then we want one between the ankles and one between the arms. So I'm going to put this here to prevent any edema from forming and pressure in the ankles. We're going to leave her phone right next to her so that she can call for assistance. That's the immediate safety aspect. Also, the arm that's above the pillow, we want to keep it extended, elbow out, and hand open. Okay, so now we're going to be talking about long-term positioning in sitting. So just a couple things to cover here. Maintain the curve and the small of the back. We can do that by placing a lumbar roll or a small pillow. Number 2, center of mass over the base of support. So making sure that they're all the way back in their chair, and that sitting weight is mainly on the thighs and the tush there. And the last one, the hips are flexed at about 90 degrees. You can ensure this by having leg rests or having a stool if they can't reach the ground. And then just a couple things about sitting in long term. So it does require more frequent repositioning, and it can also cause increased flexion contractures. Also, it does have a positive, so it does have increased blood flow and also breathing benefits. We're just going to be doing some positioning in sitting. The first thing I'm going to do is get a flexed pillow or a bent pillow and put it behind the small of your back just to make sure you're sitting up straight. Alright, and then we want to make sure that the base of support is covering the center of mass, so she's sitting up pretty straight. All of the weight is going to go into the back of the legs as well as the tush muscles there. And lastly, we want to make sure that her hips are flexed at about a 90-degree angle, and we have the leg rests there to make sure that that's happening. So again, this is going to require a little bit more positioning, and we want to make sure that the flexion contractures don't happen, so that's why we have the footrests here. If she was a patient that did have a hemi or a hemiplegia, we do want to make sure that her affected side, which we'll call it her left side in this scenario, we want to make sure that that is positioned on top of a pillow as well. So go ahead and rest that on there, right about the level of the heart. Alright, so lastly, for amputee patients, we want to make sure that their legs are fully extended and supported by the leg rest. So we want to lift this up, and she's all set. Alright, that was long-term positioning and sitting and side lying. Have a good one, guys. To call for assistance, so I'm going to leave her phone right.
Bless you.
We got a jam.
Oh no, my God.
Alright, that was long-term positioning and side lying and sitting.